Drug addiction affects millions of people all over the world. The disease of addiction does not discriminate. It does not care if you're rich, poor, female or male, disabled, young or old. And an addict will do anything to get their next high. They will do anything to avoid going through withdrawals. One common way for most addicts is through prescription drugs. They will go to an ER doctor or to a dentist and obtain a prescription for typically hydrocodone or oxycodone. Though they are abusing these drugs, and it might be their drug of choice at this time, it does eventually lead them down to full-blown heroin for most addicts. Heroin, for this case, is a much cheaper drug and a similar high, if not better. So, with that being said, approximately 3 million painkiller prescriptions are abused annually throughout this country, an epidemic that definitely needs to be addressed. Opioid Prevention Partners has come up with a solution to help combat the opioid epidemic. We have created a machine that tracks and dispenses for each patient, and within that database will not allow any pharmacist to override. That patient will be required to have a medical evaluation. It will be on a national level, and insurance is not required. This is so that insurance companies cannot influence or manipulate this system. Also, mandatory diversion testing will be required. The patient must prove they're using the opiate themselves, meaning that it must be in their system. And if the system does detect abuse, then this person will be required to attend AA, NA meetings, and rehab, inpatient rehab, much like how the court systems currently require these same requirements. Once this has been obtained and proved that the person or patient has met these requirements, it will be inputted into the system, which will then override and may or may not allow dispensing of narcotics for this individual per the discretion of their doctor or dentist or whoever is prescribing. Much like being on probation. With proper prescription control, hospitals will save millions of dollars annually. This will allow tracking of expenditures and reduce hospital out-of-pocket expenses for non-insured patients, those who do not pay back their bills. Government grants would also help out with lowering costs. Benefits of this machine: no person will be left out, tracks all dispenses per patient who has had a medical evaluation, contains accurate and up-to-date data analytics that is updated in real time. Insurance is not required, and so that is not a barrier for the hospital and or patient. It is reliable and secure, affordable due to hospital savings and government grants. It is monitored by top data analysts and scientists in the world. In conclusion, the opioid epidemic is truly horrible and kills millions of people a year, and yet many are still addicted. To combat this epidemic, there needs to be an effective way to track all prescriptions. Together with opioid prevention partners, we can help stop the opioid epidemic.